Hey everyone, a quick note before we get started. This episode is a little different from our usual complicating the narrative conversations. Over the summer, we're running a special mini-series called Better Ways of Knowing, which comes out of a new project of the same name. Better Ways of Knowing brings together researchers, practitioners, community partners, and funders to ask a fundamental question. How should we produce, evaluate, and act on knowledge if the goal is to continue to improve the health of populations? Over the next 2 years, the project will hold multiple convenings and support global learning across 4 low-middle income countries to work through that question together. After each convening, this podcast will feature the conversations that happened in the room by sitting down with some of the people who were part of them. My guest today is Alonzo Plough. Alonzo is Vice President for Research, Evaluation, and Learning, as well as Chief Science Officer of the Robert Wood Johnson Foundation, which is supporting this initiative. Before he came to philanthropy, he was an academic. And he has also spent decades running public health departments in cities like Boston, Seattle, and Los Angeles County. So he has spent his career across academia, practice, and funding, and on both sides of the gap between what research produces and what practice can use. In this conversation, we get into what that vantage point has taught him, where the mismatch between evidence and practice lives, what it means to take community knowledge seriously without giving up judgment about what rigorous science looks like, and why the foundation chose to support this work. We also talk about trust, the changing media environment, and what the public health syllabus should teach in a rapidly changing world. Here is our conversation. Alonzo, welcome to the podcast.
Glad to be here.
So I'm really excited to talk to you today, and not necessarily just because you are the funder, so we have to say a lot of nice things, which we do because you're doing great work, but also because I think your background is incredibly helpful in the discussions we're having now. During the convening, you focused on moderating a session from moving from evidence to action. And I think this was really, at least for me, during the conversation, was guided by all of the work you've done. You've came from philanthropy right now. But before that, you were someone who ran public health departments in Boston, Seattle, Los Angeles, and you also dabble and do a lot of work in academia as well. So I think to me, you're someone who actually gone through this entire spectrum of producing evidence, someone who funds evidence, but also someone who uses evidence. And based on that, and based on the conversations we had during the convening, I wanted just to maybe get an overview where you think the gaps between what the research that we produce right now, what we fund, and the practice that is actually needed to improve the health of populations.
Well, that's a big question, and let me try to break it down. But from having been an academic, I'll start there. I mean, one challenge is sort of the framework for legitimacy of academic research, which is publication in high impact journals, which may or may not be information and questions that are necessarily relevant to the practice of public health. They might be relevant to advancing a subfield, or they may be relevant as a deeper dive into important methodologies. I'm not trying to dismiss their importance, but there's kind of a bounded importance within the narrowness of what we are rewarded for in academic publications and the limitations of the reviewers, right? Because I know from having tried to publish more practice-oriented articles back in the day, it was hard when reviewers did not have that context and they were looking for, well, why didn't you randomize this particular community coalition? So as a funder, I think we have to be really explicit about research to action, what that means, and that you can do both. You can publish in high impact journals, but you also need to publish information that is relevant to the policy and practice context.
Yeah, and I think it's really important because what I also like is not just the funder or the practice or the whether we are able to publish practice-based information in existing academic structures, but also, and I think something you said during or discussed during convening and after is that you also find sometimes the way we write articles in academia, when someone graduates and comes to you to work in a public health department, please let me know if I'm misquoting you. They don't necessarily have any of the skills needed to actually do the work on the ground or take the evidence and do something with it. So I don't know if we're also training people the right way to go out and do work on the ground that improves health outcomes, and instead of just like helping them understand how to read the evidence. And those are both good skills, but I'm not sure we're giving them the skills needed on the ground to actually do the work.
Salma, I may have told a personal story when I had a sabbatical, and so I took my sabbatical in Boston to be director of public health in Boston. So I went straight from academia into running a complex health department. I will say parenthetically, with no experience, and I was also 38. So I
Yeah.
think it was only the hubris of being 38
Yeah.
that I actually made that leap because I had
Yeah.
no idea how complicated it was, and had no idea how the academic framing of things was not going to be effective. I remember giving a presentation to the city council where I presented kind of a log plot of a problem, and that got nowhere in the
Yeah.
Boston City Council. So I had to learn what it meant to communicate. I mean, you want to do science-driven practice, but you
Yeah.
need to communicate it in a way that makes sense to your elected officials, to the general population. And you had to kind of unlearn some of the ways that we write academically or speak academically and learn how to be just much more vernacular and draw on your sort of humanness and not your academic expertise. That was a big lesson in the first couple of years of my 8 years as director of public health in Boston.
Yeah.
I got
I,
better. I got much better.
I mean, you seem great right now. I can't vouch for 38-year-old Alonzo, but now you're great. Yeah.
I don't 38-year-old Alonzo needed some work, but
So I really want to go back later because I've been thinking a lot more about this since the conversation, but I'll go back to it later about like what does it look like to train students for practice, because I think that might be one area we need to focus on more, but I'll come back to that later because the third component that I think we've also discussed during the convening, and it's leading a lot of the work you're doing right now, is that thinking about community knowledge as something that is not less rigorous, but it's just different from the type of academic work that we do. And I wanted you to just tell us a bit about how you think we can push for incorporating community knowledge within the type of work we do while still maintaining the type of standards we have in academia. And how do we make sure that when we do that, people don't tell us, okay, you're just like you're using whatever biases you have and you're just deciding that is the type of knowledge that needs to be implemented.
such an important question. I think it starts back with the constructs we have as academic researchers. And one construct that we have, which is really not valid, is that we are objective and perspective free
Mm.
in our academic research. We aren't.
Yeah.
We bring our history, we bring our cultural background, we bring lots of things that filter what we see as important and how we communicate it and how we look at it. And I think it's fairly important to understand and be explicit about all forms of knowledge building, the researcher's own perspective, framing, context for doing that work. I think that's the starting point. There's no perspective-free research
Yeah.
that is conducted. So I think when we're talking about incorporating community knowledge, and we're talking about this a lot at the foundation, due to a lot of funding, but I think we have to think very rigorously about it. And because sometimes I feel and you know this very well, Salma, that what is community is a grand question in the social sciences that has many different kind of definitions. Uh, and
Yeah.
sometimes when we talk about community, we're talking about, well, that part of the community that I think resonates with the way I'm framing my issues, and that's the community. And I've been pointing out to some of my colleagues at the foundation, well, there are also people in the community who are in Maha and
Yeah.
thinking many different kinds of things when you're talking about diverse communities. Or we make assumptions, even if we're talking about an ethnic specific community. I know my own African American community.
Yeah.
There's a wide range of political positions and
Yeah.
on issues. So we make assumptions about sometimes homogeneity of communities and or maybe reify community knowledge is kind of transcendent or not without its own problems to interrogate. So I think that what we need to do is be rigorous about what we mean by community knowledge and then figure out in our approaches how we bring that into the formation of our research and not as an add-on advisory group or after the fact. How do you bring a realistic sense of community voice and experience into the framing of research questions and not just advisory when something has already been fully cooked?
I really like this because I like it for two reasons. The first one is that we think of ourselves we're doing is objective, and it's always helpful to just say, oh, no one is truly objective, and we should just put out the values that are guiding the work we're doing front and center. Like, we're all biased, even if we think we should strive to have our methods to include less bias. But as humans, we are biased. But I think the other part that I like is, and I'm so happy that the foundation is thinking about this rigorously, is that I find a lot of my colleagues who push for community engagement work as long as it aligns with the type of things that we want to implement. And as soon as someone is just different from what we want to implement, then we say, oh, they just don't have enough knowledge yet to make that educated decision.
Right.
And I feel like, yeah, you
Which,
want to
which
have your cake and eat it too. Yeah.
right, which is for a field of progressive researchers, that's very
Yeah.
paternalistic and
Yes.
very demeaning to say,
Yeah.
"Oh, you haven't achieved the consciousness yet that you
Yes.
need to be representative of our ideal notion of community." I'm borrowing a little bit of what I'm going to say in my Academy of Health closing, but I think that we really have to be more self-critical about that. I know in the foundation we are trying to be much more self-critical about that, and I know the work that you're doing and Sandra are doing in Purple Public Health. I mean, it's very important to understand a wide range of communities as they think about health and well-being, and try to find the intersection that cuts through to some more basic issues of health and well-being that transcend the political divide. I mean, that's so important now. And if we only preach to the choir, our evidence building is not going to have the impact that it should have.
I fully agree. And I think this also ties to the next point I wanted to talk about, which is we're losing trust all around. And I worry about this, not just because public health was losing trust a few years ago with COVID among Republicans, but it seems like now Republicans are in power, so Democrats are losing trust. And I worry that we live in a world where you just replace, like, whomever is in an administration taking over, about half of the country, it says, oh, no, I don't trust who's in power. And I think public health needs to be in a space where, how do we work with all communities, regardless of who's in power and who's not, and how do we make sure health is something that, yes, they care about, but also we're not trying to just assume everyone shares the same values that we have, but at the same time, we're still willing to help advance the health of population, regardless of whether people agree with us or not. But I think it's helpful then, because people listen to this, and I think that this Better Ways of Knowing initiative that is really driven by you and the foundation started recently, because that's where like, people think like public health is in a very difficult moment right now, and it is. But I just want to put a flag out there and say, you started this conversation years ago. This is not something you started now. So do you want to tell us a bit about why you thought about Better Ways of Knowing, where it came from, and what you're hoping this will achieve?
Yeah, we started when I came to the foundation 12 years ago, having a convening every year called knowledge sharing. And we brought together academics, but community voices, policymakers. We always held those meetings in a particular place. The first one was in Baltimore, and so Baltimore was part of this. We always had speakers that were very current literary voices. At that one, we had Ta-Nehisi Coates. And I've always been trying to think about knowledge building as being connected to the complexity of community and place, and requiring this kind of cross-sectoral work. So we've been thinking about it for a long time. I think we've been much more rigorous about it now, and I've gotten much more. I'm trying to put the current time, this current mistrust period that you just talked about, in broader historical context. And that has a long history. We've lost as a nation. There was quite a bit of consensus and alignment about knowledge, technology, progress coming out of World War II, right? And a guiding vision from a writer named Vannevar Bush that talked about this compact, and we were aligned around now gaining knowledge as part of a response to the Cold War, and we invested in knowledge building. I was funded in some of my doctoral work by a national defense student loan.
Hmm.
So knowledge building was seen as part of the structure of strengthening the states. We've lost. And again, coming out of that period, the 50s, 60s, much more cohesion and general trust in institutions. And some of it misplaced. We needed the disruption of the civil rights era. But again, we are way past that kind of broad national consensus, and not just public health, but you think about it, Salma, what institutions are trusted now? What professions are trusted now? Probably nursing. Nursing remains always highly trusted, and they should be.
Yeah.
But so I think we've lost that kind of compact of understanding, and it has affected public health, particularly because of the disruptions in COVID, the limitations of our being able to communicate, the uncertainty of science effectively, which was the core communication problem in COVID, right? As a clinician, all of our knowledge is, particularly in a novel virus, is approximate and subject to change, but we don't know how to talk like that. So I think that COVID, some things like that, the political polarity now, trust is public health is caught within that larger nexus
Yeah.
of problems of trust with institutions.
It's interesting what you say about trust because we just launched a survey looking at trust in the US across different institutions and across 8 countries, but in the US in particular. Scientists and academics were the highest trusted group, with a whopping 42% of people trusting them. So
Mm,
it's just not great. Like even the highest trusted group, we did not check for nurses. I think nurses would be much higher. Still, less than 50% of people trust scientists and academics in the US. That is just not a great place to be. Government is like 20%. So
right.
we're just not in a good place to be at. And I think it is helpful to put all of this into perspective of like, where we've been, and now we're not in a place of consensus. We also have, I don't know if you've thought more about, we also have different types of media. What you receive on a daily basis is just not what I receive. And if that's the case, how do we communicate to a broader public? I don't know if that's something you're also considering in the foundation, thinking about.
We are. So many things have changed in the last 40 years, but the
Yeah.
media ecology
Yeah.
40 years ago, even 30 years ago, a few major stations that people listen to, right now your media exposure is your own niche. And, I bet there's some similarity in what the feeds I get in yours. I read your Substack too. So,
Yeah. So, yeah.
but we are in these separate lanes.
Yeah.
And it's also a sense that anyone on YouTube or anyone that has a Substack or anyone is an expert to
Yeah.
some people. And so we are vying in this broader ecology of like, what is the truth?
Yeah.
And sometimes those of us in the traditional sciences just don't understand how to communicate our truth in that context. And I'm doing a couple of commencement speeches at schools of public health and that's actually the key thing I'm talking about how we communicate public health truth in this context. And I draw on the great Stephen Colbert's quote about truthiness and how does public health communicate our role, our rigor in this context of people making up information that aligns with what they believe or want to believe.
So I know this was not part of the convening or the discussion we have today, but since you're thinking about this, maybe I'll ask you that question because someone asked me this and I didn't know what to answer. I had a lecture at Haverford College and a student asked me at the end of it, I was talking about public health in a changing world, media, and then she just said, okay, so what media should I consume? Like she just wanted me to give an answer. Given everything that you said, what should I do? And I really don't know the answer to that. I don't know if you've thought about this, but I don't know what to tell her.
I have an approach that I've used, but it causes some pain to anybody. You have to sample across perspectives. I watch a little bit of Fox News, particularly when there is a sentinel event, to try to understand, well, how are they covering this? Well, what is the construct? Often I can't watch a lot of it, but I do try to sample a little bit of that. I try not just to read the New York Times. I try to also look at the Wall Street Journal's editorials. I look at the Hill. I do a smattering of what I would call the far right misinformation. That's the painful part. But I do try to read some of the serious right wing thoughtful work where people who are still evidence based have a different perspective and are using evidence that is transparent to come to look at problems in a different way that I might. I think I would suggest to the students that to try to understand some of these other perspectives and see where there's, and put the pattern together for
Yeah.
yourself.
No, I think I fully agree. It just, if you want to be informed, I think it just gets harder now. It's more of a task, but you have to do this. Like it's for anyone who's interested in being informed. I think it's more of a, It's more hard work. You need to invest more time in it. But I don't know if there is another way than just going to reputable sources, but making sure you actually sample across. It's a lot, but it's needed.
It
Yeah.
is hard work, and I think
Yeah.
from the perspective of folks who are training the next generation, it's a skill set, that I hope that, young people are learning that to be how to be a knowledgeable consumer of information.
So I want to now turn into the second part of this project that you are funding, which is the global learning component of it. RWGF over the years is famously really focused on improving health in the United States, but some of the work you're doing right now also engages with global learning. So along with the Alliance for Health Policy and Systems Research that is partnered with the World Health Organization, we're funding 4 country case studies to try to bring global learning on different ways of implementing knowledge into action in different countries and then applying them to the US. So tell us a bit about why RWGF is increasingly investing in global learning and what you're hoping to get out of that.
Well, RWJF has had a global program team for the last 12 years, and it's part of what I oversee in the foundation. And it's global ideas for U.S. solutions. And so we have been trying to learn from the rest of the world. And again, many countries have better health outcomes than we do. Even many Europeans and the countries in the global south in many areas have better health outcomes and better healthcare delivery systems than we do. So we've been trying to learn from other countries what we can to help improve what we do here in the US. So that's been the core of our global work. It's
Hmm.
becoming particularly important during the current political climate here in the States that we as a foundation are keeping a communication line open to WHO and international health partners when the federal government has sort of cut those ties. So we feel as a foundation, we have a particularly special role to connect to WHO, as you know, through the project we're both involved with and other PAHO, other international bodies, so that we can keep a flow of information between researchers and communities in the States and those international organizations.
Another thing that the RWJF is doing that is not necessarily directly linked to this, but I think is really important is the you're trying to also preserve data sources. That is something that is you as an institution you're engaged with, and I really appreciate that. I'll tell you I have formed idea and let me know what you think. I actually think in a world where AI is becoming more mainstream, having primary data sources that bring us information from the ground is increasingly needed. So in a world that we are losing access to the primary data sources, that becomes more of a challenge. But I want you maybe to talk a bit about why RWGF thinks this is a good place to invest in to continue in providing access to primary data that could be helpful for people analyzing anything related to health outcomes.
Well, I think your framing that you just stated is 3/4 baked, not half baked.
Okay. Okay.
Well, and we and
Okay.
that's kind of where we are now, trying to figure this out.
Yeah.
You know, I've been in public health a long time. I never and we planned when I was a public health practitioner for a lot of things, but we never planned for the implosion of CDC, and the loss of touchstone databases that were so important to evidence-based public health. I mean, we just didn't plan on that. So the foundation, as of last, when the change of administrations, when one of the first things they did was to begin to take down these data sets, we felt that it was really absolutely essential for public health and for the public to have this information to help guide decision making. So that is why we invested in a emergency response way to archive those databases, and then moving along when we realized how serious this was going to be in the longer run, to fund organizations to come up with other and new prospective databases to measure and monitor important public health aspects that were not being monitored or were being monitored by groups that weren't science-based. For example, funding the Vaccine Integrity Project at Minnesota to get evidence-based information on vaccine versus the vaccine advisory group at CDC, which is not evidence-based. I worried that the Preventive Service Task Force has now essentially been demolished, and maybe we might have to fund an outside body of folks who can continue to provide recommendations about what kinds of prevention services should be incorporated. One of the reasons why we're funding these regional coalitions of public health departments, 14 in the Northeast, I think almost 20 in the West, a really interesting new one in the Southeast, which is,
Mm.
has a lot of red states, but they want, they may have governors that are politically aligned certain ways, but these public health practitioners want evidence-based public health. They also want to hold on
Yeah.
to their jobs, so we have to do that in a much more delicate way, very different than what we do on the coast. But I think that's very important for public health. But as I've been writing and we've been talking about it, this data is important for democracy. It's not just health. We do a lot of work on making sure that the census is an evidence-driven instrument because it has so many implications for political representation as well as understanding health and well-being. So yeah, we're involved with that in a big way.
I think so. Then this makes me think, and I really like that RWGF is agile. It's clear that we're thinking about like what are the gaps that needs to be filled, but also prospectively, what should we think about to improve the future. Just one last question here about the role of foundations in building knowledge, because like we're talking about better ways of knowledge. And if we're being completely honest, I think a lot of the foundations work, not just your work, but generally speaking, foundations tend to be a bit cautious sometimes just focus on specific issues that is needed, especially if you have like federal funding that covers other multiple issues. But in the world that we're living in, that you think, and that's why I think you're supporting all of this work, there is a mismatch between knowledge production and outcomes on the ground. What do you think should be the role of foundations in general, not just RWGF? And I'm not just saying this, say you're agile because you're funding us, but you are agile. But like, what should foundations do moving forward? Should they fill the gap? Should they think about more innovative work that pushes the envelope forward, or should it be a combination of both?
I hesitate to speak for philanthropy, but I
Okay. Yeah.
but one of the things that's happening now in this crisis, and philanthropy is a sector that traditionally doesn't collaborate that well together, but I think under the current crisis, I've seen a whole new level of coordination. I represent the foundation on a science funders group that meets very frequently, that we share proposals and broaden each other's perspectives. I mean, I'm seeing a lot of mutual learning and stepping up to meet the problem, and more flexibility in what those foundations might fund because we're learning from each other. We might have at RWGF said a few years ago, well, we're not a democracy funder, but now we are, because much of what we're trying to, we are, the data pieces is part of that. Years ago, we said well, we're not a climate funder. We're not, but we have been for the last few years. Why we are a climate funder is because climate change is probably one of the biggest amplifier of structural racism and marginalization that there is, because who is affected by extreme weather and those issues. So I think if I'll speak from our foundation, when we strategically think about what are the drivers of the core issues that we're interested in, which is fair health outcomes, and with a particular focus on communities who historically have not had fair outcomes, you need to focus on those things that lead to that. And that means you might look at a variety of things: climate change, housing. You use the term agile. You need to move where the understanding of what the determinants are that you need to address in your funding to address it. And so I think that you see more foundations doing that, but certainly RWJF is doing that more problem focused, flexible entry points around what we need to do to improve health and well-being for particularly populations who've had historically unfair health outcomes.
So before we end, I want to go back to the convening a bit as we think also about future convenings. I know you have strong, like, just based on experience and all the work that you've done over the years, like you came into the convening with like really strong thinking about what needs to be done and learning from others on better ways of knowing. So just thinking about the 2-day conversation that we had, was there an area that you thought, "Oh, this conversation here sharpened my thinking about an issue or shifted my thinking, and this is where we need to move forward," that would be helpful for people to think about as we think about the future of public health?
Well, Salma, one of the things that was really good about that convening was, I'll put it this way: I didn't know most of the people in the room, which is unusual, right, for settings that I'm in. That because they came from different disciplines and different backgrounds. That was really important because we got different perspectives on public health. Not everybody in the room was a public health practitioner, so we got information about ways of knowing from a broad disciplinary perspectives. That was really good. I took away from that some of the folks around the table actually felt that we were being too hard on ourselves. You might
Yeah,
remember that conversation. That
yeah,
why are you people in public health just beating yourself up? You've
yeah,
done so much, and if there's a hard time, you'll get over it and get on with it.
yeah,
Thought that was important that we recognize the important things that we have done.
yeah,
And one of the reasons why there is such an attack on some of the things that we've done in public health by certain political fractions is that we have been so successful in
yeah,
framing the social determinants of health and understanding those contexts. So, that speaks to how important we were. I was really I took very seriously the comments of one of the participants on what does it mean to be talking about new ways of knowing when there is a political attempt from the right to create alternative ways of knowing that we don't think are particularly helpful, and I think you remember that
yeah,
exchange. And that person really cautioned us about, are we going to amplify some tendencies around make up your own knowledge, the
yeah,
truthiness that I
yeah.
critiqued earlier. Are we going to give fuel to that in our criticism of why we need to build knowledge in a better and more collaborative way? What differentiates what we're talking about from what some of the current administration is talking about as they develop scientific standards within federal departments generated by their own politically appointed department heads? If knowledge is up for grabs, why is our knowledge any better than their knowledge? And I think I continue to think about what it means to be critical, to kind of take this sort of epistemic challenge to science that we sometimes take, when we also have to defend science against folks who don't believe that they need an evidentiary base to make public policy decisions.
That's actually so interesting. Those are the two that really stuck with me. And I think now I'm actually going to frame some of my lectures in public health, especially when I talk about the social determinants of health. To start with, we've done a lot. Like sometimes I talk to students and it feels to me like we just talk about the critiques, which are reasonable, but sometimes if a young person doesn't know what public health achieved, then maybe it is good to start with the framing. We've done a lot of good. Like public health actually contributed to humanity a lot. But there are a lot of tremendous challenges that continue to exist. And maybe that's a good framing because I also worry about creating just a nihilist field where everyone feels like nothing ever changes. And we need to think about like how do we frame things where we don't ignore challenges, but we also acknowledge some of the progress we've made. And I agree with you. The second one I'm really thinking about more of just if we go down the road of we need to critique the knowledge bases that we have, what does that mean in a world where it seems like the basis for reality itself is being challenged by everyone? And how do we contribute in a constructive way with that? I don't know if there's an answer. I'm hoping maybe we have more answers in the next few convenings, but that one really stuck with me. I keep thinking about that one. And hopefully we'll continue to pick your brain on that one because I think we need to have a good answer of what we do that is useful without dismantling reality.
Kind of a tactical answer. I mean, it
Yeah.
is right. It's a What do you do? We at the foundation have a stream of funding that is really defending science, but we also have a stream of funding that's trying to reconstruct some of the methodology so it has more community voice. And it's a difficult balancing act. I hope in the next series of times we're together, with
Yeah.
the convenings, that we tackle that in a more operational and tactical way. What should we be doing to make that a both and? We have to protect the importance of good evidence. We at the same time have to broaden the notion of what good evidence is to include community perspectives, and be self-critical about some of the limitations of normative science, but not right. It's I don't have the algorithm, Salma,
Yeah.
for
Yeah.
for we're cutting through that right now. But
Yeah, we'll continue to try. Two last questions. The first one is just because I think we mentioned it in passing during the convening, and it's stuck in my mind, and it's something I just want to keep thinking about. It's just like, what does it mean to do this work? Like, what does this work mean for the future of creating a good public health syllabus or public health program? Like, what does that mean for teaching graduate students in the future? I don't know if we have the answers, but it's something I actually wrote down as like, this should be one of the initiatives. Like, what type of teaching and knowledge do you want to give to our students? And maybe that's one place to start. I don't know if you had more thoughts about it after the convening, but that's one thing I'm interested in.
I do have thoughts because I've been doing this a long time and was teaching a long time. When I started teaching in School of Public Health, this was at Harvard School of Public Health,
Mm.
I taught a required MPH course called The History and Sociology of Health in America. I based it in some primary sources. I took people through the history of governmental public health from the turn of the previous century. And I know particularly some of the MD, MPH students would roll their eyes like, why are we, why are we? But I think it was so important that we provided a historical context, just like what you were saying earlier. There's been a lot of progress on what public health has done, from sanitation and past milk pasteurizations, and and so I think that right now, if I was back in academia full time, I would try to make in part of the core courses something that gave a historical context to
Mm.
what public health has been and done, and not just a glowing rose tinted view of it,
Yeah.
but understanding the march of progress, and then I think putting into context some of the challenges right now. And I think that that would be one of my suggestions in the syllabus, that kind of integrative historical perspective be part of what every public health student is exposed to.
So then, well, last question here is, so we're doing this for 3 years, 2.5 years, I guess now. We're going to have a few convenings, global learning. We're hoping to also have products that are just not going to be waiting for a report to come out in 3 years, but just something that's more immediate and helpful for people. So what would success look like to you for this work that you're funding here? Like how should we move the conversation forward that you think, okay, this is something that is advancing better ways
I,
of knowing?
I think we've been talking about some of the things that I hope we will refine
Yeah.
as we go through this project. How do we communicate the importance of evidence, the threat to evidence that's happening now, but also the need to think about in a broader way what are the forms of evidence we need to drive good public health practice, and the different kinds of rigor that we need around different kinds of evidence, right? And the term being used by the administration right now, gold standard science, we make mistakes when we think there's only one standard. I mean, that traditionally gold standard was, randomization clinical trials. Much of the knowledge that we have to gain around health and well-being in community context cannot come out of that kind of a model. We're not going to randomize a group into supportive housing and good food and jobs for the future, and then put another group together with bad food, bad housing, and job
Yeah.
and terrible gig employment, and
Yeah.
then watch them for 10 years and find the obvious. So what is the standard of rigor when you're trying to understand the influence of social determinants in a community context on health outcomes? I mean, I know there are all kind of methodologies that can do that are mixed methods, but I think we have to be clearer and articulate more clearly what that looks like, right?
Yeah. Alonzo, I'm so excited to actually be doing this work, and thank you so much for supporting us. I really think it's an important moment in public health, and we hopefully can help push the conversation forward even just a bit. I think it is a needed conversation. It's a question of how do we do it in a way that is very helpful, and this has been a really helpful conversation for me. Thank you for joining us today.
Well, thank you for having me.
This episode was edited by Catalina Melendez Contreras with marketing by Kinkini Bahadre. Complicating the Narrative is supported by the WashU Persky School of Public Health, and this miniseries is part of the Building Better Ways of Knowing project, funded by the Robert Wood Johnson Foundation. If this conversation was useful to you, please pass it along to a colleague who cares about the future of public health. Thank you for listening.